Question 1. Stakeholder feedback indicates a need for occupational therapists to better integrate the ecology of human performance, APE, model into their practice. When assessing a client's ability to engage in meaningful occupations, which of the following approaches best reflects the EHP model's principles of person, task, and context interaction to determine the client's performance range? Option A. Focus primarily on identifying and addressing any perceived deficits in the client's personal skills or abilities through targeted therapeutic exercises, assuming that improving the person will automatically enhance their occupational performance across various contexts. Option B. Prioritize understanding the client's personal goals and preferences, then collaboratively identify tasks they wish to perform, and subsequently analyze the environmental context to identify barriers and facilitators that impact their ability to complete these tasks, leading to the development of tailored interventions. Option C. Emphasize the client's stated desire to perform specific tasks and proceed with interventions aimed at facilitating those tasks, without a thorough analysis of the client's personal capacities or the specific contextual factors that may impede or support performance. Option D. Concentrate on making extensive modifications to the client's physical and social environment, believing that an optimized environment will enable the client to perform any task they desire, regardless of their personal capabilities or the task's inherent demands. Correct answer is B. Prioritize understanding the client's personal goals and preferences, then collaboratively identify tasks they wish to perform, and subsequently analyze the environmental context to identify barriers and facilitators that impact their ability to complete these tasks, leading to the development of tailored interventions. Explanation: this scenario is professionally challenging because it requires the occupational therapist to balance the client's immediate needs and preferences with the broader ecological factors influencing their participation and the therapist's ethical and regulatory obligations. The therapist must move beyond a purely client-centered approach to consider the interplay of person, task, and context as defined by the ecology of human performance, APE model. Careful judgment is required to ensure interventions are not only client-approved, but also ecologically sound and promote sustainable performance. The correct approach involves a comprehensive assessment that integrates the client's self-report with observations of their performance within their natural or simulated environments. This approach aligns with the OTR regulatory framework, which mandates that occupational therapists practice in a manner that is evidence-based, client-centered, and considers the impact of the environment on occupational performance. Specifically, the EHP model guides this by emphasizing that performance is a product of the interaction between the person, the task, and the context. The therapist's role is to identify barriers and facilitators within this interaction to enhance occupational engagement. This approach is ethically justified by the principle of beneficence, ensuring interventions are effective and promote well-being, and by the principle of justice, ensuring equitable access to services that address the whole person within their environment. An incorrect approach that focuses solely on the client's stated desires without considering the contextual barriers or the inherent demands of the task fails to adhere to the EHP model's core tenets. This could lead to interventions that are not sustainable or effective in the long term, potentially violating the regulatory requirement for competent and effective practice. Ethically, this approach could be seen as a failure of non-maleficence if the intervention, while desired by the client, ultimately proves ineffective or even detrimental due to unaddressed contextual or task-related challenges. Another incorrect approach that prioritizes modifying the person's skills or abilities in isolation, without adequately addressing the context or task demands, also deviates from the EHP model. This overlooks the dynamic nature of human performance and the reciprocal influence of the environment. Regulatory failure here lies in not employing a holistic assessment and intervention strategy that considers all components of the EHP model, potentially leading to interventions that are not client-centered in the broadest sense of promoting meaningful participation. Ethically, this could be a failure to provide comprehensive care. A further incorrect approach that focuses exclusively on environmental modifications without considering the person's capabilities or the nature of the tasks they wish to perform neglects the interactive nature of performance. While environmental adaptation is a key strategy within EHP, it is not the sole determinant of performance. This approach risks creating an environment that is not aligned with the person's abilities or occupational goals, leading to ineffective outcomes and potentially violating regulatory expectations for client-centered and occupation-based practice. Ethically, this could represent a failure to fully understand and address the client's occupational needs. The professional decision-making process for similar situations should involve a systematic application of the EHP model. This begins with understanding the client's goals and values person. Then, the therapist analyzes the specific tasks the client wishes to perform and their inherent demands. Crucially, the therapist must then assess the context in which these tasks are performed, identifying physical, social, and cultural factors. Finally, the therapist synthesizes this information to understand the resulting performance range and collaboratively develops intervention strategies that may involve establishing/restoring a person's abilities, adapting the task, modifying the context, or a combination of these. This iterative process ensures that interventions are grounded in a deep understanding of the client's unique situation and the ecological factors influencing their occupational performance, thereby meeting regulatory and ethical standards. Question 2. Cost-benefit analysis shows that implementing a comprehensive occupational therapy intervention plan based on the Coleman Evaluation of Living Skills, (CELS), can lead to reduced long-term care costs and improved client quality of life. Given a client who has expressed a strong desire to return to independent living, but whose CELS results indicate significant challenges in areas such as medication management and financial responsibility, which of the following represents the most ethically and professionally sound course of action for an occupational therapist registered OTR? Option A. Focus solely on the client's expressed desire for independence and discharge them with general recommendations, assuming they will seek assistance if needed. Option B. Recommend a transition to a supported living environment with ongoing occupational therapy services to address specific CELS deficits, while actively involving the client in the decision-making process and exploring adaptive strategies. Option C. Advise the client that their CELS scores indicate they are not safe for independent living and immediately recommend placement in a residential care facility without further discussion. Option D. Overlook the CELS findings related to medication management and financial responsibility, as these are often managed by family members, and proceed with a plan for independent living. The correct answer is B. Recommend a transition to a supported living environment with ongoing occupational therapy services to address specific CELS deficits, while actively involving the client in the decision-making process and exploring adaptive strategies. Explanation: this scenario is professionally challenging because it requires an occupational therapist to balance the client's expressed desire for independence with the objective assessment of their safety and ability to manage essential living skills. The CELS is a tool designed to evaluate these skills, and its results have direct implications for the client's living situation and potential need for support services. The therapist must navigate the ethical imperative to promote client autonomy while upholding the professional responsibility to ensure client safety and well-being, adhering to the standards of practice for occupational therapists registered, OTR. The correct approach involves a comprehensive review of the CELS results, considering the client's performance across all subscales, and then collaboratively developing a plan with the client that addresses identified deficits while respecting their goals. This approach aligns with the OTR's ethical principles of beneficence, acting in the client's best interest, and respect for autonomy, honoring the client's right to self-determination. It also adheres to the professional standards that mandate evidence-based practice and client-centered care, ensuring that interventions are tailored to individual needs and preferences, and that the client is an active participant in their care planning. An incorrect approach would be to solely rely on the client's subjective report of their ability to live independently without considering the objective findings of the CELS. This fails to uphold the therapist's duty of care and could lead to unsafe living situations, violating the principle of non-maleficence, avoiding harm. Another incorrect approach would be to unilaterally impose a restrictive living arrangement based solely on a few low scores on the CELS, without engaging the client in a discussion about the findings and exploring less restrictive alternatives. This disregards the client's autonomy and the principle of least restrictive intervention. Furthermore, failing to document the rationale for the intervention plan, including how the CELS results inform the recommendations, would be a breach of professional documentation standards and could hinder continuity of care. The professional reasoning process should involve 1. understanding the purpose and limitations of the KELs. 2. Conducting a thorough assessment and interpreting the results in the context of the client's overall situation. 3. Engaging the client in a discussion about the findings and their implications. 4. Collaboratively setting realistic goals and developing an intervention plan that prioritizes safety and promotes independence to the greatest extent possible. And 5. Documenting all assessments, interventions, and client communications meticulously. Question 3. The control framework reveals that an occupational therapist is working with a client who expresses a strong desire to resume a high-risk recreational activity that the therapist believes the client is currently not functionally prepared for, potentially leading to injury. Which of the following approaches best reflects the occupational therapist's professional responsibilities in this situation? Option A. Proceed with the client's desired activity as requested, respecting their autonomy and assuming they are aware of the potential consequences. Option B. Immediately prohibit the client from engaging in the activity due to the perceived risk of injury, prioritizing safety above all else. Option C. Collaboratively explore the client's motivations for the activity, assess current functional capabilities relevant to the activity, identify potential risks and facilitators, and jointly develop a plan that may involve activity modification, preparatory interventions, or alternative occupations that meet similar needs. Option D. Implement a standardized intervention program focused on general strength and balance, without directly addressing the client's specific desire or assessing their readiness for the chosen activity. The correct answer is C. Collaboratively explore the client's motivations for the activity, assess current functional capabilities relevant to the activity, identify potential risks and facilitators, and jointly develop a plan that may involve activity modification, preparatory interventions, or alternative occupations that meet similar needs. Explanation. This scenario presents a professional challenge because the occupational therapist must balance the client's expressed desires with the therapist's professional judgment regarding the client's safety and potential for meaningful engagement. The therapist's ethical and legal obligations require them to promote client autonomy while also ensuring client well-being and competent practice. The core of the challenge lies in interpreting and applying occupational therapy theories and models to a situation where a client's chosen activity may not align with their current functional abilities or perceived benefits. The correct approach involves a thorough assessment of the client's current capabilities, the underlying rationale for their chosen activity, and potential barriers or facilitators to participation, all within the context of established occupational therapy models. This approach prioritizes a client-centered understanding, exploring the client's values, interests, and goals as per the occupational therapy practice framework, domain and process, while simultaneously evaluating their performance skills and patterns. The therapist then uses this comprehensive understanding to collaboratively develop an intervention plan that addresses the client's goals in a safe, effective, and occupationally relevant manner, potentially adapting the activity or exploring alternative occupations that meet similar needs. This aligns with the ethical principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as well as the regulatory requirement to provide services within the scope of practice and based on sound professional judgment. An incorrect approach that focuses solely on the client's stated desire without further assessment fails to uphold the therapist's responsibility to ensure safety and efficacy. This could lead to harm if the client attempts an activity beyond their current capabilities, violating the principle of non-maleficence. It also neglects the therapist's duty to provide evidence-based interventions and to facilitate meaningful occupational engagement, potentially leading to frustration and a lack of progress. Another incorrect approach that dismisses the client's interest outright based on the therapist's initial perception of the activity's value is paternalistic and undermines client autonomy. This violates the principle of respect for persons and the client's right to self-determination. It also fails to explore the client's underlying motivations, which might reveal important therapeutic goals that could be addressed through alternative means. A third incorrect approach that involves imposing a predetermined intervention without exploring the client's perspective or assessing their current abilities disregards the client-centered nature of occupational therapy. This approach is not grounded in a thorough understanding of the client's unique needs and goals, and therefore is unlikely to lead to effective or meaningful outcomes, potentially violating regulatory expectations for individualized care. The professional reasoning process for similar situation should involve a systematic approach. First, actively listen to and understand the client's stated goals and preferences. Second, conduct a comprehensive occupational therapy assessment, utilizing relevant theoretical models e.g. person-environment occupation performance, model of human occupation, to understand the interplay of client factors, environmental influences, and the demands of the occupation. Third, collaboratively problem-solve with the client, discussing findings, exploring potential risks and benefits, and co-creating an intervention plan that aligns with their goals and promotes optimal participation and well-being. This iterative process ensures that interventions are both client-centered and professionally sound. Question 4. What factors determine the most effective and culturally sensitive approach for an occupational therapist to address a client's engagement in meaningful occupations when cultural beliefs may influence their perceptions of health, illness, and family roles? Option A. Focusing primarily on the client's diagnosed condition and establish therapeutic protocols, assuming cultural factors are secondary to clinical outcomes. Option B. Applying generalized knowledge of common cultural practices to all clients from a perceived ethnic or racial group, without individual assessment. Option C. Actively seeking to understand the client's cultural worldview and collaboratively developing occupation-based goals that are meaningful and relevant within their cultural context. Option D. Prioritizing the therapist's own understanding of ideal occupational engagement based on their cultural background, expecting the client to adapt. The correct answer is C. Actively seeking to understand the client's cultural worldview and collaboratively developing occupation-based goals that are meaningful and relevant within their cultural context. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an occupational therapist to navigate the complex interplay of a client's cultural background, personal beliefs, and their engagement in meaningful occupations. Health disparities are often rooted in systemic issues and historical contexts that influence access to resources and perceptions of health and wellness. A failure to acknowledge and address these factors can lead to ineffective interventions, client dissatisfaction, and perpetuation of health inequities. Careful judgment is required to balance universal occupational therapy principles with individualized, culturally responsive care. Correct approach analysis. The correct approach involves actively seeking to understand the client's cultural worldview, including their beliefs about health, illness, family roles, and the significance of specific activities. This understanding informs the collaborative development of occupation-based goals that are meaningful and relevant within the client's cultural context. This aligns with the AYATA Occupational Therapy Practice Framework, OTF, which emphasizes client-centered care and the importance of considering the client's context, including cultural factors, in the therapeutic process. Ethical standards, such as those outlined in the AYATA Code of Ethics, mandate that occupational therapists provide services in a manner that is respectful of diversity and promotes justice, which includes addressing health disparities. Incorrect approach is analysis, an approach that focuses solely on the client's physical or cognitive limitations without exploring their cultural background risks, imposing external values and expectations, leading to interventions that are not aligned with the client's lived experience or priorities. This fails to uphold the principle of client-centered care and can be perceived as culturally insensitive. An approach that assumes all individuals from a particular cultural group share the same beliefs and practices is a form of stereotyping. Cultural competence requires recognizing the diversity within cultural groups and treating each client as an individual. This approach violates the ethical imperative to respect individual differences and can lead to misinterpretations and ineffective treatment. An approach that prioritizes the therapist's own cultural norms or assumptions about what constitutes a healthy or productive occupation, without engaging the client in a dialogue about their values, is ethnocentric. This approach neglects the client's autonomy and their right to define their own meaningful occupations and life roles, and it fails to address potential health disparities that may be influenced by cultural misunderstandings. Professional reasoning. Professionals should employ a reflective practice model that includes self-awareness of their own cultural biases, ongoing education in cultural humility, and a commitment to learning from each client. When faced with diverse populations, the decision-making process should begin with an open inquiry into the client's cultural context and its influence on their occupations. This involves active listening, asking open-ended questions, and collaborating with the client to co-create goals and interventions that are both therapeutically sound and culturally congruent. Question 5. Examination of the data shows that an occupational therapist has completed an assessment of motor and process skills, AMPS, on a client performing a familiar task. The therapist has observed the client's performance and is now faced with the task of rating the quality of the observed motor and process skills. Which of the following represents the most appropriate approach for the occupational therapist to take in rating these skills? Option A. Systematically apply the AMPS rating scales to each observed motor and process skill, considering the observable actions and their impact on task completion, using the definitions and examples provided in the AMPS manual. Option B. Rate the skills based on the therapist's personal judgment of what constitutes good performance for this type of task, irrespective of the client's specific observable actions. Option C. Assign a global rating based on the therapist's overall impression of the client's functional ability during the task. Option D. Rely primarily on the client's self-report of their challenges and successes during the task to determine the quality of their motor and process skills. The correct answer is A. Systematically apply the AMPS rating scales to each observed motor and process skill, considering the observable actions and their impact on task completion, using the definitions and examples provided in the AMPS manual. Explanation. This scenario is professionally challenging because it requires the occupational therapist to move beyond simply observing a client's performance during the assessment of motor and process skills AMPS to making a nuanced judgment about the quality of that performance. This involves subjective interpretation within a standardized framework, necessitating a deep understanding of the AMPS rating scales and the underlying principles of occupational performance. The therapist must balance objective observation with professional judgment, ensuring that their ratings are consistent, reliable, and ethically sound, adhering to the established standards of practice for occupational therapists. The correct approach involves meticulously applying the AMPS-defined rating scales for motor and process skills, considering the observable behaviors and their impact on task completion. This approach is right because it aligns with the core principles of the AMPS, which are designed to provide a standardized and objective measure of occupational performance. By focusing on observable actions and their functional significance, the therapist ensures that their ratings are grounded in evidence and are defensible. This adherence to the AMPS manual and its established scoring criteria is a direct reflection of professional competence and ethical practice, as it promotes consistency and reliability in assessment, which is crucial for effective intervention planning and communication with other professionals and stakeholders. An incorrect approach would be to rely solely on a general impression of the client's overall ability, without systematically rating each motor and process skill according to the AMPS criteria. This fails to uphold the standardized nature of the AMPS, leading to potentially biased or unreliable ratings. Ethically, this approach violates the principle of beneficence by not providing an accurate assessment that can lead to appropriate interventions. Another incorrect approach would be to rate skills based on the therapist's personal expectations of what a client should be able to do, rather than on the observable performance and its impact on task completion as defined by the AMPS. This introduces personal bias and deviates from the objective measurement the AMPS aims to achieve, potentially leading to misdiagnosis or inappropriate treatment plans. A further incorrect approach would be to rate skills based on the client's subjective report of their difficulties without direct observation of performance. While client self-report is valuable, the AMPS specifically requires observation of performance to rate the quality of motor and process skills. Failing to observe performance directly undermines the validity of the AMPS assessment. Professional decision-making in such situations requires a systematic process. First, thoroughly understand the AMPS manual and its rating scales. Second, meticulously observe the client's performance during the selected task, focusing on specific motor and process skills. Third, apply the AMPS rating scales objectively, considering the observable behaviors and their impact on task completion. Fourth, document the ratings and the rationale for each, referencing specific observations. And finally, use these ratings to inform intervention planning and communicate findings clearly and accurately to relevant parties. Question 6. When evaluating a client's desire to participate in a new, physically demanding hobby, which approach best reflects a comprehensive application of the model of human occupation, MOHO principles, considering volition, habituation, performance capacity, and environment. Option A. Focus solely on the client's stated interest in the hobby, overriding any concerns about their current physical limitations or established routines. Option B. Dismiss the client's interest in the hobby due to their existing health condition, without exploring their volition or potential for adaptation. Option C. Immediately recommend modifications to the client's home environment to accommodate the hobby, assuming their desire indicates sufficient capacity. Option D. Conduct a thorough assessment of the client's intrinsic motivation and personal causation for the hobby. Analyze their current daily routines and roles to see how the hobby might fit. Evaluate their physical and cognitive abilities to perform the hobby's demands, and assess the physical and social environment for supports and barriers. Correct answer is D. Conduct a thorough assessment of the client's intrinsic motivation and personal causation for the hobby. Analyze their current daily routines and roles to see how the hobby might fit. Evaluate their physical and cognitive abilities to perform the hobby's demands, and assess the physical and social environment for supports and barriers. Explanation. This scenario presents a professional challenge because the occupational therapist must balance the client's expressed desires with the therapist's professional judgment regarding the client's capacity and environmental supports, all within the framework of the model of human occupation, MOHO. The core of the challenge lies in accurately assessing volition, habituation, and performance capacity to determine if the client's chosen activity is realistic and beneficial, and how the environment might facilitate or hinder participation. Careful judgment is required to avoid imposing personal biases while ensuring client safety and promoting meaningful engagement. The correct approach involves a comprehensive assessment of all MOHO components. This means thoroughly evaluating the client's intrinsic motivation and personal causation, volition, their routines and roles, habituation, and their physical and cognitive abilities, performance capacity. Crucially, it also requires understanding how the client's environment, physical, social, and cultural supports or impedes their participation in the chosen activity. This holistic perspective, grounded in MOHO principles, allows the occupational therapist to develop an intervention plan that is client-centered, evidence-based, and promotes occupational adaptation. This aligns with the ethical and regulatory requirements for occupational therapists to provide competent and individualized care, ensuring that interventions are tailored to the client's unique needs and circumstances, and that the therapist acts in the client's best interest. An incorrect approach would be to solely focus on the client's stated desire for the activity without a thorough assessment of their underlying capacities and environmental factors. This failure to conduct a comprehensive MOHO assessment could lead to an intervention that is not appropriate, potentially resulting in client frustration, failure, or even harm. Would also represent a failure to adhere to professional standards that mandate a thorough evaluation process. Another incorrect approach would be to dismiss the client's desire based on a superficial understanding of their condition, without exploring the underlying volition and potential for adaptation. This approach risks undermining the client's autonomy and self-efficacy, and fails to recognize the potential for growth and change that MOHO emphasizes. Would be a violation of the principle of client-centered care, and could lead to a lack of engagement and trust. A third incorrect approach would be to prioritize environmental modifications without adequately assessing the client's internal capacities and volition. While environmental adaptation is a key component of MOHO, it must be integrated with an understanding of the individual's internal drivers and abilities. Focusing solely on the environment without considering the person's internal experience would be an incomplete and potentially ineffective intervention strategy. The professional reasoning process for similar situations should involve a systematic application of the MOHO framework. This begins with understanding the client's goals and motivations, volition. Next, the therapist should analyze the client's daily routines and roles, habituation, to understand how the desired occupation fits into their life. Following this, a detailed assessment of the client's physical, cognitive, and psychosocial abilities, performance capacity, is essential. Finally, the therapist must analyze the client's environment to identify facilitators and barriers to participation. This comprehensive understanding allows for the development of targeted interventions that address all aspects of the occupational therapy process, ensuring client-centered, effective, and ethical care. Question 7. The performance metrics show a consistent decrease in a client's ability to independently manage their personal care routines and participate in community outing due to increasing physical limitations and unfamiliarity with new assistive devices. Considering the occupational adaptation (OA) model, which of the following approaches best addresses this situation to promote the client's adaptive capacity and pursuit of relative mastery? Option A. Collaboratively identify specific occupational challenges related to personal care and community participation. Explore the client's personal standards for mastery in these areas, and co-create strategies that enhance their ability to adapt to new demands and utilize assistive devices effectively. Option B. Primarily focus on providing extensive training on the new assistive devices, assuming that improved technical proficiency will automatically lead to increased occupational participation and mastery. Option C. Implement environmental modifications to simplify personal care tasks and suggest alternative, less demanding community activities, without directly engaging the client in developing their own adaptive responses. Option D. Recommend a reduction in the client's occupational engagement in personal care and community activities, focusing solely on maintaining their current level of function to prevent further decline. The correct answer is A. Collaboratively identify specific occupational challenges related to personal care and community participation. Explore the client's personal standards for mastery in these areas, and co-create strategies that enhance their ability to adapt to new demands and utilize assistive devices effectively. Explanation. The performance metrics show a decline in a client's engagement with meaningful occupations, specifically in their ability to adapt to new challenges in their home environment. This scenario is professionally challenging because it requires the occupational therapist, OTR, to move beyond simply identifying deficits and instead focus on the client's inherent capacity for adaptation and their pursuit of relative mastery within their occupational roles. The OTR must consider the interplay between the client's abilities, the demands of the occupational challenges, and the environment's support for adaptation. This requires a nuanced understanding of the occupational adaptation (OA) model, which emphasizes the client's active role in the adaptation process. The correct approach involves collaborating with the client to identify specific occupational challenges that are hindering their participation, and then exploring strategies that enhance their adaptive capacity. This means working with the client to understand their personal standards for mastery and to develop interventions that support their ability to meet these standards in the face of changing demands. This aligns with the core principles of occupational therapy, as outlined by the American Occupational Therapy Association, AOTA, Standards of Practice and Code of Ethics, which mandate client-centered care, respect for autonomy, and the promotion of occupational participation. Specifically, the ethical principle of beneficence requires the OT to act in the client's best interest, which includes fostering their independence and well-being through adaptive strategies. An incorrect approach would be to solely focus on modifying the environment without actively engaging the client in the adaptation process. This fails to acknowledge the client's adaptive capacity and their role in achieving relative mastery. Ethically, this approach risks disempowering the client and may not lead to sustainable changes, potentially violating the principle of justice by not providing the most effective and client-driven care. Another incorrect approach would be to solely focus on improving the client's physical or cognitive skills in isolation, without considering how these skills are applied to overcome specific occupational challenges and achieve mastery. This overlooks the core tenet of OA, which is the interaction between the person, the occupation, and the environment. Such an approach could lead to interventions that are not occupationally relevant or meaningful to the client, failing to promote genuine adaptation. A third incorrect approach would be to assume that the client's current level of performance is fixed, and to simply provide compensatory strategies without exploring opportunities for the client to develop new adaptive responses. This neglects the dynamic nature of adaptive capacity and the potential for growth and improvement inherent in the OA model. The professional decision-making process for similar situations should involve a thorough occupational profile to understand the client's roles, values, interests, and goals. This should be followed by an analysis of the occupational challenges and the client's current adaptive responses. The OTR should then collaboratively set goals with the client, focusing on enhancing their adaptive capacity and achieving relative mastery within their desired occupations. Interventions should be designed to facilitate the client's active participation in the adaptation process, with ongoing evaluation and adjustment based on the client's progress and feedback. Question 8. The evaluation methodology shows a client expressing a strong desire to engage in a specific, unconventional hobby as their primary occupational goal, which the therapist perceives as having limited direct functional rehabilitation benefits and being logistically challenging to facilitate within typical service parameters. Which approach best aligns with the philosophical base of occupational therapy and best practice standards for an occupational therapist registered OTR? Option A. Gently steer the client towards more conventional therapeutic activities that have a clearer, evidence-based link to functional improvement, explaining that the chosen hobby is not a typical focus for occupational therapy. Option B. Acknowledge the client's interest but proceed with a standard intervention protocol for their diagnosed condition, assuming the client will eventually adapt their goals to fit the available therapeutic options. Option C. Collaboratively explore the client's motivations for this hobby. Identify potential adaptations or modifications to make it achievable, and integrate it into the therapeutic plan as a meaningful occupation that contributes to their overall well-being and sense of self. Option D. Design a treatment plan that focuses solely on improving underlying physical or cognitive deficits, with the expectation that the client can pursue their hobby independently once their functional abilities improve. The correct answer is C. Collaboratively explore the client's motivations for this hobby. Identify potential adaptations or modifications to make it achievable, and integrate it into the therapeutic plan as a meaningful occupation that contributes to their overall well-being and sense of self. Explanation. This scenario is professionally challenging because it requires the occupational therapist to balance the inherent value and dignity of the client with the practicalities of service delivery and resource allocation. The core values of occupational therapy, such as humanism and a holistic perspective, mandate that the client's unique needs, desires, and context are central to the therapeutic process. The principle of client-centered practice further emphasizes this by requiring active client participation in goal setting and decision-making. The philosophical base of occupational therapy views occupation not just as a means to an end, a therapeutic tool, but also as an end in itself, meaningful engagement for its own sake. The correct approach is to engage in a collaborative process with the client to identify meaningful occupations that align with their values and goals, even if these occupations are not the most conventionally recognized or easily facilitated. This approach upholds the core values of humanism by respecting the client's autonomy and inherent worth, and the holistic perspective by considering their entire life context. It embodies client-centered practice by prioritizing the client's perspective and participation in defining what constitutes a valuable occupation. This aligns with the philosophical understanding that occupation is both a means to improve function and an end in itself, contributing to well-being and identity. Regulatory frameworks for occupational therapists, such as those established by the National Board for Certification in Occupational Therapy, NBCOT, and state licensing boards, emphasize ethical practice, client autonomy, and the provision of services that are meaningful and relevant to the client's life. An incorrect approach would be to dismiss the client's chosen occupation due to its perceived lack of conventional therapeutic benefit or ease of implementation. This fails to uphold the humanistic value of respecting the client's inherent worth and their right to self-determination. It also contradicts the holistic perspective by narrowly defining what constitutes a valid occupation, ignoring the client's personal meaning and context. Such an approach would be a failure in client-centered practice, as it prioritizes the therapist's judgment over the client's expressed needs and desires. Ethically, this could be seen as paternalistic and disrespectful of client autonomy. Another incorrect approach would be to unilaterally impose therapeutic goals and occupations without sufficient client input or collaboration. This directly violates the principle of client-centered practice, which requires active partnership. It also undermines the humanistic value of respecting the client's agency and their right to make choices about their own lives and therapeutic journey. A further incorrect approach would be to focus solely on the means aspect of occupation, using it purely as a tool to achieve specific functional outcomes, while disregarding its potential as an end in itself. This overlooks the profound impact of meaningful engagement on a client's sense of purpose, identity, and overall well-being, which is a cornerstone of the philosophical base of occupational therapy. The professional reasoning process for similar situations should begin with a thorough understanding of the client's values, goals, and desired occupations, as articulated by the client. This involves active listening and open-ended questioning. The therapist should then explore how these desired occupations can be adapted, modified, or integrated into the therapeutic plan to promote participation and well-being, while also addressing any identified functional deficits. Collaboration with the client to co-create goals and strategies is paramount. If there are significant barriers to the client's chosen occupation, the therapist should explore these collaboratively and problem-solve with the client, rather than dismissing the occupation outright. Ethical guidelines and professional standards of practice should always guide the decision-making process, ensuring that client autonomy, dignity, and the pursuit of meaningful occupation are prioritized. Question 9. Regulatory review indicates that an occupational therapist is working with an adult client who has mild cognitive impairments following a stroke. The client expresses a strong desire to resume gardening, a beloved hobby. However, during the assessment, the therapist observes that the client has significant balance deficits and a tendency to become easily fatigued, raising concerns about the safety of prolonged standing and the use of sharp gardening tools. The client is insistent on returning to their previous gardening routine without modifications. Which of the following approaches best addresses this ethical dilemma while adhering to the AOTA Code of Ethics and promoting client well-being? Option A. Immediately prohibit the client from gardening due to the identified safety risks, explaining that their current functional level makes it too dangerous. Option B. Educate the client and their family about the identified risks of gardening without modifications. Collaboratively explore adaptive strategies and equipment to make gardening safer and more accessible, and involve the client in selecting preferred modifications. Option C. Delegate the primary responsibility of assessing and managing the safety risks of gardening to the client's family without direct therapist intervention in the modification process. Option D. Proceed with the client's request to garden as they wish, assuming they understand the risks, and document their insistence. The correct answer is B. Educate the client and their family about the identified risks of gardening without modifications. Collaboratively explore adaptive strategies and equipment to make gardening safer and more accessible, and involve the client in selecting preferred modifications. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's expressed desire and the occupational therapist's professional judgment regarding safety and efficacy. The client's insistence on a potentially harmful activity, coupled with their cognitive limitations, creates an ethical tightrope. The occupational therapist must balance the principles of autonomy, beneficence, and non-maleficence while adhering to the AOTA Code of Ethics. Careful judgment is required to ensure the client's well-being without unduly infringing upon their right to self-determination. The correct approach involves a collaborative and educational strategy. This entails clearly communicating the risks associated with the client's desired activity, exploring alternative, safer methods to achieve similar goals, and involving the client's family or caregivers in the decision-making process to ensure a comprehensive understanding of the situation and to support the client's safety. This aligns with the AOTA Code of Ethics, specifically the principles of beneficence, acting for the good of others, and non-maleficence, avoiding harm. It also respects the principle of autonomy by attempting to educate the client and involve them in finding solutions, rather than simply imposing restrictions. An incorrect approach would be to immediately deny the client's request without thorough exploration of alternatives or education. This would violate the principle of autonomy by disregarding the client's wishes and could be perceived as paternalistic. Another incorrect approach would be to proceed with the activity as requested, despite the identified risks, without adequate safety precautions or client education. This would directly contraindicate the principle of non-maleficence and potentially violate beneficence by exposing the client to harm. Finally, unilaterally making the decision without any attempt to involve the client or their support system would fail to uphold the principles of justice, fairness in providing services, and veracity, truthfulness in communication. Professionals should employ a decision-making framework that prioritizes ethical reflection. This involves identifying the ethical principles at play, gathering all relevant information, including client history, cognitive status, and environmental factors, exploring potential courses of action, weighing the ethical implications of each action against the AOTA code of ethics and relevant laws, consulting with supervisors or colleagues when necessary, and documenting the decision-making process and rationale. The ultimate goal is to achieve the best possible outcome for the client, while upholding professional integrity and ethical standards. Question 10. The monitoring system demonstrates that a client with a recent stroke, who expresses a strong desire to resume gardening, is experiencing significant difficulty with balance and fine motor control. Their home environment has uneven terrain in the garden and a lack of adaptive tools. The occupational therapist is considering how to best support the client's occupational performance in gardening. Which of the following approaches best reflects a client-centered, ethically sound, and PEO-informed intervention strategy? Option A. Proceed with teaching the client advanced gardening techniques that mimic their pre-stroke abilities, assuming they will adapt quickly to the environmental challenges. Option B. Collaboratively assess the client's current abilities and limitations in relation to gardening tasks. Explore environmental modifications, e.g., raised garden beds, accessible pathways, and identify adaptive equipment or techniques to enhance safety and participation, while respecting the client's desire to garden. Option C. Advise the client that gardening is currently too risky given their balance and fine motor deficits, and suggest they focus on less demanding sedentary activities until their recovery is more advanced. Option D. Recommend the client hire a professional gardener to maintain their garden, as their current functional level makes independent gardening unsafe and impractical. The correct answer is B. Collaboratively assess the client's current abilities and limitations in relation to gardening tasks. Explore environmental modifications, e.g., raised garden beds, accessible pathways, and identify adaptive equipment or techniques to enhance safety and participation, while respecting the client's desire to garden. Explanation. This scenario presents a professional challenge because it requires balancing the client's expressed desires with the occupational therapist's ethical and professional responsibility to ensure safety and promote meaningful occupational engagement, all within the framework of the person-environment-occupation (PEO) model. The occupational therapist must consider how the client's personal factors, e.g., motivation, cognitive abilities, environmental factors, e.g., home safety, community accessibility, and the occupation itself, e.g., complexity, risk, interact to influence occupational performance. Ethical practice demands client-centered care, but this must be tempered with professional judgment regarding potential harm and the therapist's duty to advocate for the client's well-being and optimal functioning. The correct approach involves a collaborative assessment and intervention planning process that prioritizes client participation while integrating professional expertise. This approach aligns with the PEO model by systematically analyzing the interplay of person, environment, and occupation to identify barriers and facilitators to occupational performance. Specifically, it requires the therapist to engage the client in discussing their goals and preferences, person and occupation, assess the home environment for safety and accessibility, and then collaboratively develop strategies that enhance occupational performance within that environment. This is ethically justified by the principle of client autonomy and beneficence, ensuring that interventions are meaningful to the client while also promoting their safety and well-being. Regulatory frameworks for occupational therapists, such as those governed by the NBCOT, National Board for Certification in Occupational Therapy, in the U.S., emphasize client-centered practice, evidence-based interventions, and ethical conduct, all of which support this collaborative and analytical approach. An incorrect approach would be to unilaterally impose a solution without thorough client involvement, or to dismiss the client's expressed desires due to perceived minor risks. For instance, simply refusing to consider the client's preferred activity due to a slight environmental hazard without exploring adaptive strategies or modifications would violate the principle of client autonomy and potentially limit meaningful occupational engagement. Another incorrect approach would be to proceed with an intervention that significantly compromises safety, even if desired by the client, without adequate risk assessment and mitigation strategies. This would fail to uphold the therapist's ethical duty of non-maleficence and could lead to adverse outcomes, contravening regulatory expectations for safe and competent practice. Professional decision-making in such situations should follow a structured process. 1. Identify the ethical dilemma and relevant professional principles, e.g., autonomy, beneficence, non-maleficence. 2. gather comprehensive information about the person, environment, and occupation, involving the client as an active participant. 3. Analyze the interplay of these factors using a relevant model like PEO to understand potential risks and benefits. 4. Explore a range of intervention options, considering feasibility, client preferences, and safety. 5. Collaborate with the client to select and implement the most appropriate intervention, ensuring informed consent. 6. Continuously monitor and reevaluate the intervention's effectiveness and safety, making adjustments as needed. Question 11. Governance review demonstrates that an occupational therapist is working with a client who expresses a strong desire to resume gardening, a cherished occupation. However, based on the therapist's initial assessment of the client's current physical limitations and cognitive status, the therapist has concerns about the client's safety and ability to perform the activity independently without modifications. The client, however, insists on returning to their previous gardening routine without any changes, which approach best aligns with the principles of the occupational therapy practice framework, domain and process in addressing this situation. Option A. Introduce a completely different occupation that the therapist believes is more suitable for the client's current abilities, without further consultation on the client's preference for gardening. Option B. Immediately inform the client that gardening is too risky given their current limitations, and suggest they engage in a less physically demanding activity that the therapist deems more appropriate. Option C. Engage in a collaborative discussion with the client to reevaluate their current client factors, explore the specific activity demands of gardening, and jointly problem-solve potential modifications or adaptive strategies to enable safe and meaningful participation. Option D. Proceed with the client's original gardening plan without further discussion, assuming the client understands the risks involved and is willing to accept them. The correct answer is C. Engage in a collaborative discussion with the client to reevaluate their current client factors, explore the specific activity demands of gardening, and jointly problem-solve potential modifications or adaptive strategies to enable safe and meaningful participation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the occupational therapist to balance the client's stated preferences with the therapist's professional judgment regarding the client's capacity and safety. The challenge lies in ensuring the client's autonomy is respected, while also fulfilling the therapist's ethical and legal duty to provide appropriate and safe care, as guided by the Occupational Therapy Practice Framework, OTF. The OTF emphasizes a client-centered approach, but this must be integrated with an understanding of client factors and activity demands to ensure meaningful and safe engagement in occupations. Correct approach analysis. The correct approach involves a collaborative process of reevaluating the client's ability to engage in the desired occupation, considering their current client factors, e.g., cognitive status, physical limitations, and the specific activity demands of gardening. This approach aligns with the OTF emphasis on the dynamic interplay between client, occupation, and context. It requires the therapist to use their professional expertise to assess the client's performance skills and patterns in relation to the occupation, and to educate the client about potential risks and modifications. This upholds the ethical principle of beneficence, acting in the client's best interest and non-maleficence, avoiding harm, while respecting client autonomy. The OTF process section, particularly evaluation and intervention, guides this approach by requiring a comprehensive understanding of the client's occupational profile and performance. Incorrect approach is analysis. One incorrect approach involves immediately dismissing the client's request based solely on the therapist's initial perception of risk. This fails to uphold the client-centered principles of the OTF, which advocate for client participation in goal setting and intervention planning. It overlooks the potential for adaptive strategies or modifications that could enable safe engagement. This approach also risks violating the client's right to self-determination. Another incorrect approach is to proceed with the original plan without any further assessment or discussion, despite the identified concerns. This demonstrates a failure to apply professional judgment and to adequately consider the client's current client factors and the activity demands. It neglects the therapist's responsibility to ensure the safety and efficacy of intervention, potentially leading to harm or a lack of meaningful occupational engagement, which is contrary to the core tenets of occupational therapy as outlined in the OTF. A third incorrect approach is to impose a completely different occupation without client input or a clear rationale tied to the client's goals, while the therapist may identify a more appropriate occupation. Forcing it upon the client disregards the importance of client choice and the therapeutic relationship, which are integral to successful occupational therapy outcomes, as described in the OTR. Professional reasoning. Professionals should utilize a systematic decision-making process that begins with a thorough understanding of the client's occupational profile and goals, as outlined in the OTR. When discrepancies arise between client desires and therapist assessment, the process should involve 1. Reevaluation of client factors and performance skills in relation to the specific occupation and its demands. 2. Collaborative discussion with the client to explore their understanding of the occupation, potential challenges, and their willingness to consider modifications or alternative approaches. 3. Joint problem solving to identify adaptive strategies, environmental modifications, or alternative occupations that align with the client's goals and promote safe, meaningful engagement. 4. Documentation of the assessment, collaborative decision-making process, and the rationale for the chosen intervention plan. Question 12. The audit findings indicate a need to assess the occupational therapist's understanding of the historical evolution of the profession. Which of the following best demonstrates an understanding of how historical eras and key figures have shaped the core ethical and practice principles of occupational therapy? Option A. Describing the influence of the World Wars on the expansion of occupational therapy services without connecting these developments to the earlier philosophical underpinnings of the profession. Option B. Listing the names of prominent figures in occupational therapy history, including Benjamin Rush and Alina Clark Barton, without detailing their specific contributions or the broader historical context. Option C. Explaining how the moral treatment era's emphasis on humane care and purposeful activity, championed by figures like Pinnell and Tuke, established the foundational principles of client-centered care and the therapeutic use of occupation, further solidified by the rehabilitation needs arising from the World Wars. Option D. Identifying the chronological order of significant events and individuals in occupational therapy history, such as the moral treatment era, the contributions of Philippe Pinnell and William Tuke, and the impact of the World Wars. The correct answer is D. Identifying the chronological order of significant events and individuals in occupational therapy history, such as the moral treatment era, the contributions of Philippe Pinnell and William Tuke, and the impact of the World Wars. Explanation. The audit findings highlight a common challenge in professional practice, ensuring that current therapeutic approaches are grounded in and informed by the historical evolution of the profession. This scenario is professionally challenging because it requires an occupational therapist to demonstrate not just knowledge of historical periods, but also an understanding of how those periods shape the core tenets and ethical underpinnings of occupational therapy as it exists today. A superficial understanding of history can lead to misinterpretations of current practice or a failure to appreciate the foundational principles that continue to guide the profession. Careful judgment is required to accurately connect historical movements to contemporary ethical and practice standards. The correct approach involves recognizing that the moral treatment era, with its emphasis on humane care and purposeful activity, directly laid the groundwork for occupational therapy's focus on client-centered care and the therapeutic use of occupation. Key figures like Pinnell and Tuke championed the idea that individuals with mental illness could benefit from structured environments and meaningful engagement, a concept that remains central to occupational therapy. The influence of the World Wars further solidified the profession's role in rehabilitation and adaptation, expanding its scope and solidifying its identity. This approach demonstrates a deep understanding of the profession's lineage and its ethical commitment to promoting well-being through occupation. This aligns with the overarching ethical principles of occupational therapy, which emphasize client dignity, autonomy, and the pursuit of meaningful life roles, all of which have historical roots in the moral treatment movement and subsequent developments. An incorrect approach would be to focus solely on the chronological order of events without analyzing their impact on the profession's core values and practices. For instance, simply listing the key figures without explaining their contributions to the philosophical underpinnings of occupational therapy would be a superficial understanding. Another incorrect approach would be to overemphasize the impact of one historical period, such as the World Wars, to the exclusion of the foundational principles established during the moral treatment era. This would fail to acknowledge the comprehensive historical development that has shaped the profession's ethical framework and scope of practice. A further incorrect approach might be to conflate occupational therapy's history with that of other healthcare professions, failing to identify the unique trajectory and philosophical underpinnings that define occupational therapy. The professional reasoning process for similar situations should involve a critical analysis of historical information, moving beyond mere memorization to an understanding of cause and effect. Professionals should ask, how did this historical development influence the ethical principles and practice standards of occupational therapy? And what enduring lessons from this period are still relevant to my practice today? This analytical approach ensures that historical knowledge serves as a foundation for ethical decision-making and effective client care. Question 13. Research into best practices for occupational therapy documentation reveals varying approaches to capturing client information. An occupational therapist is preparing an evaluation report for a client with a recent diagnosis of Parkinson's disease, focusing on their ability to engage in daily living activities. Which of the following approaches best reflects adherence to legal and ethical guidelines for documentation? Option A, including detailed personal anecdotes shared by the client about their family history and social relationships, as these provide context for their life experiences. Option B, focusing primarily on the medical diagnosis and prognosis, with minimal detail on specific functional deficits or the interventions planned. Option C, using vague and generalized statements about the client's overall condition, without specific examples of performance or limitations. Option D, documenting objective observations of the client's motor skills, balance, and cognitive abilities as they relate to task performance, along with specific functional limitations, and the therapist's professional assessment of how these impact the client's occupational roles. The correct answer is D, documenting objective observations of the client's motor skills, balance, and cognitive abilities as they relate to task performance, along with specific functional limitations, and the therapist's professional assessment of how these impact the client's occupational roles. Explanation: this scenario is professionally challenging because it requires the occupational therapist to balance the need for comprehensive documentation with the ethical obligation of client confidentiality and the practical constraints of time. Accurate and thorough documentation is a legal and ethical requirement, serving as a record of services provided, justifying reimbursement, and facilitating communication among healthcare professionals. However, the inclusion of extraneous or overly detailed personal information not directly related to the client's functional status or occupational performance can violate privacy, increase the risk of data breaches, and potentially lead to misinterpretations or biases. The occupational therapist must exercise careful judgment to ensure all documented information is relevant, objective, and directly supports the intervention plan and progress towards goals. The correct approach involves meticulously documenting objective observations of the client's performance, functional limitations, and progress towards established goals. This includes specific details about the interventions provided, the client's response to those interventions, and any modifications made to the plan. This approach aligns with best practice standards for occupational therapy documentation, which emphasize the importance of clear, concise, accurate, and timely records. Legally and ethically, this ensures that the documentation serves its intended purpose of reflecting the client's occupational needs and the therapist's professional judgment, while also adhering to privacy regulations such as HIPAA, Health Insurance Portability and Accountability Act, in the United States, which mandates the protection of protected health information. 5. Ethical guidelines from the American Occupational Therapy Association, AOTA, also stress the importance of accurate and objective record-keeping. An incorrect approach that includes subjective opinions, personal judgments about the client's character, or irrelevant details about the client's social life fails to meet professional standards. This type of documentation can be considered a violation of ethical principles, particularly those related to objectivity and professional boundaries. It also poses a legal risk by potentially including information that is not directly related to the provision of occupational therapy services, thus increasing the scope of PHI that needs to be protected and potentially leading to a breach of confidentiality if not handled with extreme care. Furthermore, such documentation may not adequately justify the services provided for reimbursement purposes and could be challenged by payers. Another incorrect approach that omits key details about the client's functional performance, the interventions used, and the client's response to treatment is also professionally unacceptable. This failure to document essential information can be seen as a breach of professional responsibility and may violate legal requirements for record keeping. It hinders continuity of care, as other healthcare professionals may not have a clear understanding of the client's progress or the rationale behind the treatment plan. Ethically, it can be considered negligence if it compromises the quality of care or client safety due to incomplete information. The professional decision-making process for similar situations should involve a systematic review of documentation requirements, focusing on the purpose of each note. Evaluation. Progress discharge. Therapists should ask themselves, is this information objective? Is it directly related to the client's occupational performance and goals? Does it justify the services provided? Does it adhere to privacy regulations? By consistently applying these questions, occupational therapists can ensure their documentation is legally sound, ethically compliant, and professionally robust. Question 14. To address the challenge of ensuring a client's safety during daily living activities while respecting their autonomy and promoting independence, which approach to occupational performance assessment is most appropriate? Option A. Immediately implementing environmental modifications and activity restrictions based on initial observations of potential hazards, without a detailed assessment of the client's functional capabilities. Option B. Relying solely on the client's verbal assurances of safety and their stated ability to manage risks without objective observation or performance-based assessment. Option C. Focusing exclusively on identifying and eliminating all potential environmental hazards, regardless of the client's personal risk tolerance or their ability to adapt to changes. Option D. Conducting a comprehensive occupational performance assessment that integrates a systematic risk assessment of the client's environment and their ability to manage potential hazards during meaningful occupations. The correct answer is D. Conducting a comprehensive occupational performance assessment that integrates a systematic risk assessment of the client's environment and their ability to manage potential hazards during meaningful occupations. Explanation. This scenario is professionally challenging because it requires an occupational therapist to balance the client's immediate safety needs with their right to self-determination and participation in meaningful occupations. The therapist must conduct a thorough risk assessment without unduly restricting the client's autonomy or making assumptions about their capabilities. Careful judgment is required to identify potential hazards, evaluate the likelihood and severity of harm, and implement appropriate interventions that promote safety while maximizing independence. The correct approach involves a comprehensive occupational performance assessment that specifically incorporates a risk assessment component. This means systematically identifying potential hazards within the client's environment and during their engagement in specific occupations, evaluating the client's ability to perceive and mitigate these risks, and determining the level of support or environmental modification needed to ensure safety without compromising occupational engagement. This aligns with the ethical principles of beneficence, acting in the client's best interest, and respect for autonomy, as mandated by the Occupational Therapy Practice Framework, Domain and Process, 4th ed., and relevant state licensure laws that require practitioners to provide safe and effective care. The process involves observation, client interview, and potentially standardized assessments to gather data on the client's functional abilities, cognitive status, and environmental factors contributing to risk. An incorrect approach would be to immediately implement restrictive measures or prohibit certain activities without a thorough assessment of the underlying risks and the client's capacity to manage them. This fails to uphold the principle of client-centered care and may lead to unnecessary limitations on the client's occupational engagement and quality of life. Another incorrect approach would be to solely rely on the client's self-report of safety without objective observation or assessment of their performance in the relevant context. This overlooks potential safety concerns that the client may not recognize or be able to articulate, thereby failing to meet the therapist's duty of care. A third incorrect approach would be to focus exclusively on the environmental hazards without considering the client's specific abilities, limitations, and preferences, leading to interventions that are not tailored to the individual and may not be effective in promoting safe participation. Professionals should use a decision-making framework that begins with understanding the client's goals and priorities. This is followed by a comprehensive assessment that includes identifying potential risks, evaluating the client's capacity to manage those risks, and collaboratively developing interventions that promote safety and occupational participation. This process should be iterative, with ongoing monitoring and adjustment of interventions based on the client's progress and evolving needs, always prioritizing client autonomy within the bounds of safety. Question 15. Analysis of a situation where a client from a collectivist culture expresses reluctance to participate in an independent living skills program due to family obligations and beliefs about shared decision-making. What is the most ethically and professionally sound approach for the occupational therapist to take? Option A. Collaborate with the client and their family to understand their cultural values regarding family involvement in healthcare decisions, and integrate these perspectives into a modified program that respects their cultural norms while still addressing functional goals. Option B. Assume that the client's family is over-involved and attempt to limit their participation in therapy sessions to foster the client's autonomy. Option C. Advise the client that their cultural beliefs are hindering their progress and encourage them to adopt a more individualistic approach to achieve independence, as this is the standard in Western rehabilitation. Option D. Proceed with the independent living skills program as designed, explaining to the client that individual independence is the primary goal of occupational therapy and that family involvement can hinder progress. The correct answer is A. Collaborate with the client and their family to understand their cultural values regarding family involvement in healthcare decisions, and integrate these perspectives into a modified program that respects their cultural norms while still addressing functional goals. Explanation. This scenario is professionally challenging because it requires the occupational therapist to navigate deeply ingrained cultural beliefs that may differ significantly from their own or standard Western medical practices. The therapist must balance the client's right to self-determination and cultural autonomy with the goal of promoting health and well-being, all while adhering to professional ethical standards and regulatory requirements. The core challenge lies in providing effective care without imposing personal or dominant cultural values, ensuring that interventions are not only clinically sound, but also culturally congruent and respectful. The correct approach involves actively seeking to understand the client's cultural context and integrating this understanding into the occupational therapy plan. This aligns with the American Occupational Therapy Association, AOTA, Occupational Therapy Practice Framework, Domain and Process 4th ed., which emphasizes the importance of client-centered care and the influence of context, including cultural context, on occupational performance. Specifically, the framework highlights that culture is the learned behavior, beliefs, values, and practices of a group of people, and that occupational therapists must consider these factors when evaluating and intervening with clients. This approach respects the client's autonomy and promotes engagement by ensuring that interventions are meaningful and acceptable within their cultural framework, thereby enhancing the likelihood of successful outcomes and adherence. It also aligns with ethical principles of beneficence and non-maleficence by aiming to do good and avoid harm, which includes cultural harm or alienation. An incorrect approach that focuses solely on the client's physical limitations without acknowledging or inquiring about their cultural beliefs regarding illness, healing, or family involvement would be professionally unacceptable. This failure to consider cultural context violates the principle of client-centered care and the AOTA framework's emphasis on understanding the client's lived experience. It risks alienating the client, leading to non-adherence and potentially ineffective treatment, and could be seen as a form of cultural insensitivity, which is ethically problematic. Another incorrect approach that involves dismissing or overriding the client's cultural practices because they are perceived as less effective or traditional would also be a significant ethical and regulatory failure. This approach demonstrates a lack of cultural humility and respect for diversity, directly contradicting the AOTA Code of Ethics, which calls for occupational therapists to treat clients with respect, fairness, and integrity, and to advocate for clients' rights. Imposing one's own cultural norms or beliefs on a client is a form of cultural imposition and can lead to mistrust and a breakdown in the therapeutic relationship. A third incorrect approach that involves making assumptions about the client's cultural beliefs based on stereotypes or generalizations, without direct communication and verification with the client, is also professionally unsound. This can lead to misinterpretations and the development of an inappropriate intervention plan. The AOTA framework stresses the importance of collaboration and communication with clients to understand their unique perspectives and needs. Relying on stereotypes bypasses this crucial step and can result in culturally insensitive and ineffective care. The professional decision-making process for similar situations should begin with a commitment to cultural humility and a proactive stance in seeking to understand the client's cultural background. This involves active listening, open-ended questioning, and a willingness to learn from the client. The occupational therapist should then integrate this cultural information into their assessment and intervention planning, ensuring that all proposed strategies are discussed with and agreed upon by the client and their family, as appropriate within their cultural context. This collaborative and respectful process ensures that care is both clinically effective and culturally congruent, upholding the highest ethical and professional standards. Question 16. The investigation demonstrates that a client, following a recent stroke, is experiencing significant challenges in resuming their pre-stroke daily routines and participating in hobbies they once enjoyed. The occupational therapist needs to comprehensively understand the client's current level of engagement in various activities and their perceived importance of these activities to inform a client-centered intervention plan. Which assessment approach would best facilitate this understanding? Option A, focusing solely on standardized assessment measuring motor skills and cognitive deficits to quantify functional limitations. Option B, inferring the client's occupational engagement based on observations of their physical and cognitive impairments. Option C, administering the activity card sort acts to explore the client's past, present, and desired future participation in a wide range of daily activities and their perceived importance. Option D, conducting a general interview about the client's daily schedule without a structured framework for assessing occupational engagement. The correct answer is C, administering the activity card sort acts to explore the client's past, present, and desired future participation in a wide range of daily activities and their perceived importance. Explanation. The investigation demonstrates a scenario where an occupational therapist must select the most appropriate assessment tool to understand a client's occupational engagement, specifically when considering the impact of a recent stroke. This is professionally challenging because the therapist needs to move beyond simply identifying deficits and instead focus on the client's participation in meaningful activities, which is central to the occupational therapy process and aligns with the profession's philosophical underpinnings. Careful judgment is required to ensure the chosen assessment accurately reflects the client's lived experience and informs a client-centered intervention plan. The correct approach involves utilizing the activity card sort acts to identify the client's perceived importance of and participation in various daily activities. This approach is correct because the ACS is specifically designed to assess occupational engagement by exploring the client's past, present, and desired future participation in a broad range of activities. It directly addresses the core of occupational therapy by focusing on what the client does and wants to do . This aligns with regulatory frameworks that emphasize client-centered practice, the promotion of occupational participation, and the use of evidence-based assessments that capture the client's perspective. The ACS provides a holistic view of occupational engagement, allowing the therapist to identify areas of loss and areas of potential for recovery and adaptation, thereby informing a more effective and meaningful intervention plan. An incorrect approach would be to solely rely on standardized assessment that measure functional deficits, such as range of motion or grip strength, without directly exploring the client's engagement in meaningful activities. This fails to capture the client's subjective experience and the impact of their condition on their ability to participate in valued occupations. Ethically and regulatorily, this approach is deficient as it may lead to interventions that do not address the client's personal goals or priorities, potentially hindering their overall well-being and occupational adaptation. Another incorrect approach would be to conduct a broad interview about the client's daily routine without a structured tool to systematically explore occupational engagement. While interviews are valuable, a lack of structure can lead to misinformation or an incomplete understanding of the client's occupational profile. This could result in a less comprehensive assessment of their engagement in meaningful activities, failing to fully leverage the benefits of a systematic occupational assessment. A further incorrect approach would be to assume the client's engagement levels based on their physical limitations without direct inquiry. This paternalistic approach overlooks the client's agency and their ability to adapt and find new ways to engage in activities. It fails to acknowledge that engagement is a complex interplay of personal factors, environmental influences, and the activity itself, and that the client's perspective is paramount in understanding their occupational life. The professional decision-making process for similar situations should involve a systematic evaluation of the client's needs and goals, followed by the selection of assessment tools that are evidence-based, client-centered, and aligned with the core principles of occupational therapy. This includes considering tools that explore occupational participation and engagement, not just functional capacity. The therapist must critically analyze the psychometric properties of potential assessments and their suitability for the specific client and their context, always prioritizing the client's voice and their ability to engage in meaningful occupations. Question 17. During the evaluation of an elderly client who recently experienced a fall at home and is now expressing fear of falling again, which of the following assessment approaches would best capture the client's current occupational performance and identify environmental factors contributing to their safety concerns? Option A. Conducting a home safety evaluation that includes direct observation of the client attempting to perform daily activities such as meal preparation, toileting, and ambulation within their own residence, alongside a structured interview about their perceived safety. Option B. Relying solely on the client's verbal report of their limitations and fears, without any direct observation of their functional abilities or environmental assessment. Option C. Utilizing a standardized questionnaire that measures fear of falling, without assessing the client's actual functional performance or the home environment. Option D. Administering a battery of standardized cognitive and motor assessments in the clinic, followed by a review of their medical history. The correct answer is D. Administering a battery of standardized cognitive and motor assessments in the clinic, followed by a review of their medical history. Explanation. This scenario is professionally challenging because it requires the occupational therapist to balance the need for comprehensive assessment with the client's immediate functional goals and the practical limitations of the environment. The therapist must employ a contextual assessment approach that considers the client's performance in their natural environment, rather than solely relying on standardized, decontextualized tests. This aligns with the core principles of occupational therapy, which emphasize client-centered practice and the importance of occupation within its context. The correct approach involves conducting an assessment that directly observes and evaluates the client's performance of meaningful occupations within their home environment. This allows for the identification of environmental barriers and facilitators that impact the client's ability to participate in daily activities. This approach is ethically and regulatorily justified by the Occupational Therapy Practice Framework, Domain and Process, OTF, which emphasizes the importance of context and environment in understanding and facilitating occupational performance. Specifically, the OTF highlights that occupational therapy interventions are most effective when they are grounded in the client's lived experience and performed in their natural settings. An incorrect approach would be to solely administer standardized, decontextualized assessments in a clinic setting. This fails to capture the nuances of the client's functional abilities and challenges within their actual living space, potentially leading to an incomplete or inaccurate understanding of their needs. This approach is ethically problematic as it may not be client-centered and could lead to interventions that are not relevant or effective in the client's daily life. It also fails to meet the regulatory expectation of providing services that are tailored to the individual's context. Another incorrect approach would be to rely solely on the client's self-report without direct observation or objective assessment of their performance in their home. While self-report is valuable, it can be subjective and may not fully reflect actual functional limitations or environmental influences. This approach risks overlooking critical environmental factors or performance deficits that the client may not be aware of or able to articulate. This is ethically questionable as it may not provide a comprehensive basis for intervention planning. A third incorrect approach would be to focus exclusively on the client's medical diagnosis and its typical functional implications, without a thorough assessment of their specific occupational performance and environmental context. While understanding the diagnosis is important, It should not replace a personalized assessment of how that diagnosis impacts the individual's ability to engage in their unique occupations within their unique environment. This approach risks overgeneralizing and failing to address the client's specific needs and goals. Professionals should employ a decision-making process that prioritizes understanding the client's goals and values, followed by selecting assessment methods that are most likely to yield relevant and ecologically valid information. This involves considering the client's environment as an integral part of the assessment, utilizing a combination of standardized and non-standardized measures, and observing performance in naturalistic settings whenever possible. The process should be iterative, with assessment findings informing intervention and ongoing evaluation. Question 18. The risk matrix shows a potential for misalignment between a client's self-identified priorities for occupational performance and the therapist's clinical assessment of the most impactful areas for intervention. An occupational therapist is working with a client who has recently experienced a stroke and is using the Canadian Occupational Performance Measure, COPM, to guide goal setting. The client expresses a strong desire to return to playing a specific video game, which they describe as their primary source of enjoyment and social connection. The therapist, however, notes significant deficits in fine motor control and visual scanning that, in their clinical judgment, would make playing this game extremely challenging and potentially frustrating in the short term, and believes focusing on basic activities of daily living, ADL, and gross motor tasks would be more foundational for overall recovery. Which approach best reflects the occupational therapist's role in this situation, adhering to the principles of client-centered care and the application of the COPM. Option A. Proceed with interventions focused on ADLs and gross motor tasks, documenting the client's interest in the video game as a long-term aspiration, but not as an immediate goal, as it is not clinically feasible in the current stage of recovery. Option B. Gently steer the client towards focusing on ADLs and gross motor tasks, explaining that these are more critical for their immediate recovery, and that the video game can be revisited once these foundational skills are mastered. Option C. Collaboratively explore the client's interest in the video game, acknowledging its importance to their social participation and enjoyment, and then work with the client to break down the skills required for playing the game into smaller, achievable steps, integrating the therapist's clinical expertise to address the identified fine motor and visual scanning deficits within this context. Option D. Acknowledge the client's interest in the video game but inform them that due to their current functional limitations, it is not a realistic goal and suggest alternative, less demanding leisure activities that are more aligned with their current abilities. The correct answer is C. Collaboratively explore the client's interest in the video game, acknowledging its importance to their social participation and enjoyment, and then work with the client to break down the skills required for playing the game into smaller, achievable steps, integrating the therapist's clinical expertise to address the identified fine motor and visual scanning deficits within this context. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the occupational therapist to navigate a situation where a client's stated priorities may not align with the therapist's clinical judgment regarding the most impactful areas for intervention. Balancing client autonomy with professional expertise, while ensuring the intervention plan is evidence-based and effective, is a core ethical and professional responsibility. The therapist must demonstrate cultural competence and respect for the client's lived experience, while also upholding their duty to provide competent care. Correct approach analysis. The correct approach involves actively listening to the client's self-identified priorities for occupational performance and using these as the foundation for goal setting. This aligns directly with the client-centered philosophy inherent in occupational therapy and is a cornerstone of the Canadian Occupational Performance Measure (COPM). The COPM purpose is to identify problems in occupational performance as defined by the client and to measure changes in these areas. By prioritizing the client's own definition of what is important and meaningful, the therapist fosters engagement, motivation, and adherence to the intervention plan. This approach respects client autonomy and self-determination, which are fundamental ethical principles in healthcare. Furthermore, it ensures that the intervention is relevant and meaningful to the client's life, increasing the likelihood of successful outcomes. Incorrect approaches analysis. One incorrect approach involves prioritizing the therapist's clinical judgment over the client's stated priorities without thorough exploration. This fails to uphold the client-centered nature of occupational therapy and can lead to a disconnect between the intervention and the client's actual needs and desires. Ethically, this can be seen as paternalistic and may undermine the therapeutic alliance. It also fails to leverage the client's intrinsic motivation, which is crucial for sustained engagement and progress. Another incorrect approach is to dismiss the client's priorities as less important or achievable without a collaborative discussion. This disregards the client's lived experience and their unique perspective on what constitutes meaningful occupation. It can lead to feelings of being unheard or misunderstood, potentially damaging the therapeutic relationship and leading to disengagement from therapy. A third incorrect approach is to proceed with an intervention plan based solely on the therapist's assessment without explicitly linking it to the client's stated goals, even if the therapist believes it will indirectly address the client's concerns. While the therapist's clinical expertise is vital, the intervention must be demonstrably connected to the client's identified areas of concern, as measured by the COPM. Failing to do so means the intervention may not be perceived as relevant by the client, diminishing its effectiveness and the client's satisfaction with the process. Professional reasoning. Professionals should utilize a decision-making framework that begins with active listening and empathic inquiry to understand the client's perspective and priorities. This involves using tools like the COPM to elicit and document these priorities. Following this, the therapist should engage in a collaborative discussion to explore the client's goals, their perceived importance, and their performance in these areas. The therapist's clinical expertise should then be used to inform the intervention strategies that will best address the client's identified needs, always in partnership with the client. This iterative process ensures that the intervention plan is both client-centered and clinically sound, respecting the client's autonomy while maximizing the potential for positive occupational outcomes. Question 19. Compliance review shows that an occupational therapist registered, OTR, is developing an intervention plan for a new client. The client states, "I just want to be able to do my grocery shopping independently again." Which of the following approaches to gathering further information for the occupational profile is most aligned with OTR regulatory requirements and ethical practice? Option A. Ask the client to describe their typical grocery shopping routine before their current challenges, what they enjoy about it, and what makes it difficult now. Option B. Immediately begin assessing the client's physical and cognitive abilities related to grocery shopping tasks. Option C. Provide the client with a standardized questionnaire about their daily activities and ask them to complete it before the next session. Option D. Focus solely on the client's current home environment and their ability to prepare meals, as this is a direct outcome of not being able to grocery shop. The correct answer is B. Immediately begin assessing the client's physical and cognitive abilities related to grocery shopping tasks. Explanation. This scenario presents a professional challenge because the occupational therapist must balance the client's immediate stated desires with a comprehensive understanding of their occupational history, experiences, and underlying goals. Simply accepting the client's initial request without further exploration risks developing an intervention plan that is not truly client-centered or effective in promoting meaningful occupational engagement. Careful judgment is required to ensure the occupational profile is robust and accurately reflects the client's unique context. The correct approach involves actively engaging the client in a detailed discussion about their past and present occupations, their values, interests, and perceived barriers and supports. This approach aligns with the fundamental principles of occupational therapy, which emphasize understanding the client's lived experience and tailoring interventions to their specific needs and aspirations. Regulatory frameworks, such as those governing the Occupational Therapist Registered (OTR) credential in the United States, mandate a thorough occupational profile as the foundation for all therapeutic services. This includes gathering information about the client's occupational history and experiences, identifying their goals and priorities, and understanding the context in which they engage in occupations. Ethical guidelines further underscore the importance of client-centered care, requiring OTs to respect client autonomy and actively involve them in the decision-making process. An incorrect approach would be to solely rely on the client's initial, brief statement of what they want to achieve. This fails to gather sufficient information about their occupational history and experiences, potentially leading to a superficial understanding of their needs. It also bypasses the opportunity to explore underlying motivations and values that might inform more effective goal setting. This approach risks not meeting the regulatory requirement for a comprehensive occupational profile and violates the ethical principle of providing client-centered care by not fully understanding the client's unique situation. Another incorrect approach would be to assume the client's stated goal is the only relevant one and to immediately design interventions based on that assumption without further exploration. This neglects the critical step of understanding the client's broader occupational context, their past successes and challenges, and their personal values. Such an approach may lead to interventions that are not aligned with the client's true priorities or that do not address potential underlying factors hindering their occupational participation. This demonstrates a failure to adhere to the regulatory mandate for a thorough occupational profile and an ethical lapse in not fully exploring the client's occupational identity and aspirations. A third incorrect approach would be to focus exclusively on the client's current functional limitations without adequately exploring their occupational history and desired future occupations. While understanding limitations is important, an occupational profile requires a holistic view that encompasses past experiences, current engagement, and future aspirations. Overlooking the client's occupational history and experiences means missing valuable insights into their strengths, preferences, and the meaning they derive from various activities. This can lead to interventions that are not truly meaningful or sustainable for the client, failing to meet the comprehensive requirements of the occupational profile and the ethical imperative of promoting client well-being through meaningful occupation. A professional decision-making process for similar situations should involve a systematic approach to gathering information. This begins with an open-ended invitation for the client to share their story and their reasons for seeking occupational therapy. The OT should then employ active listening and probing questions to elicit details about their occupational history, their roles, their values, their interests, and their perceived barriers and supports. This information is then synthesized to collaboratively establish meaningful and achievable goals that are grounded in the client's unique occupational profile. Throughout this process, the OT must remain mindful of regulatory requirements and ethical principles, ensuring that the client's autonomy is respected and that the intervention plan is truly client-centered. Question 20. Comparative studies suggest that when an occupational therapist is working with a client who expresses a strong desire to return to a specific, potentially challenging, occupation that holds deep personal meaning, the therapist should prioritize understanding the client's unique perspective. Considering the Canadian model of occupational performance and engagement, CMOP, which approach best reflects ethical and regulatory requirements for fostering client engagement and well-being. Option A. Focus exclusively on improving the client's physical and cognitive capacities related to the occupation, without delving into the subjective meaning or spiritual aspects the client associates with it. Option B. Implement a standardized rehabilitation program for the occupation, assuming that adherence to the protocol will automatically lead to successful engagement and satisfaction. Option C. Gently steer the client towards more conventional or less demanding occupations that are typically associated with their condition, based on the therapist's experience and perceived likelihood of success. Option D. Collaboratively explore the client's goals and values, investigate the personal meaning and spiritual significance of the desired occupation, and jointly develop strategies to address environmental and personal factors that may impact engagement, ensuring the client's autonomy and informed decision-making. The correct answer is D. Collaboratively explore the client's goals and values, investigate the personal meaning and spiritual significance of the desired occupation, and jointly develop strategies to address environmental and personal factors that may impact engagement, ensuring the client's autonomy and informed decision-making. Explanation. This scenario is professionally challenging because it requires an occupational therapist to balance the client's expressed desires with the therapist's professional judgment, all within the ethical and regulatory framework governing occupational therapy practice in Canada. The Canadian model of occupational performance and engagement, CMOP, emphasizes a client-centered approach, recognizing the interconnectedness of person, occupation, and environment, with spirituality as the core. A key ethical consideration is respecting client autonomy while ensuring the provision of safe and effective care. The correct approach involves a collaborative process where the occupational therapist actively listens to the client's goals and values, explores the meaning of the occupation to the client, and considers how the environment influences their participation. This approach aligns with the CMAP's emphasis on spirituality as the unique essence of each individual, influencing their choices and engagement in occupations. Regulatory bodies in Canada, such as provincial colleges of occupational therapists, mandate that practitioners engage in client-centered care, respect client autonomy, and practice within their scope. This approach ensures that interventions are meaningful and relevant to the client's life, promoting engagement and well-being. An incorrect approach would be to dismiss the client's stated desire for a specific occupation simply because it appears challenging or deviates from a typical rehabilitation path. This fails to acknowledge the client's personal meaning and spirituality attached to that occupation, potentially undermining their motivation and engagement. Ethically, this could be seen as paternalistic and a failure to uphold client autonomy. Another incorrect approach would be to focus solely on the physical or cognitive aspects of the occupation without exploring its broader meaning or the client's environmental context. This neglects the holistic nature of the CMAP and the interconnectedness of person, occupation, and environment. Regulatory failure would occur if the therapist did not adequately assess the client's capacity, safety, and the potential benefits and risks associated with the chosen occupation, thereby failing to provide competent and ethical care. The professional reasoning process should involve a thorough assessment of the client's strengths, challenges, values, and goals. This includes understanding the client's perception of the occupation and its significance to their spirituality. The therapist should then collaboratively develop an intervention plan that respects the client's autonomy, addresses potential barriers, and promotes meaningful engagement. This process requires ongoing communication, flexibility, and a commitment to client-centered practice, as guided by the CMAP and professional standards of practice.